appreciate everyone from joining today. I'd also like to honor to have Jesse and Jeremy join us today as well. So we look forward to a roundtable type discussion today. We'll kind of be highlighting our experiences and what we're seeing occurring in the healthcare space, and how you can look to modernize, transform, and innovate using technology. So we appreciate your attendance today. So in terms of the agenda, we're going to jump right in here to looking at some common healthcare goals and objectives. Then we'll be highlighting some opportunities and examples, some solution examples for everyone. And then we'll provide a brief overview of ServiceNow ResultsPositive and how we help organizations achieve those healthcare goals and objectives. Then we'll talk about starting points and next steps, and have an opportunity for a roundtable discussion as well. So we appreciate your attendance today, and look forward to interactive session. As Sean mentioned, feel free to queue up your questions, and we'll be able to answer those in the roundtable discussion. So thanks again for attending today. And as we mentioned, our focus today is around healthcare goals and objectives, and really focusing on the business outcomes that healthcare organizations are looking to achieve. So we see three major areas in terms of strategic goals and objectives. First is around quality care. So how to improve overall quality of care, effectiveness of care, and really driving to some of those core metrics that your organizations are looking to achieve. Next is around patient satisfaction. We know there's a lot of incentive around patient satisfaction with reimbursement rates associated with how healthcare organizations are getting paid. And then on top of that, there's the real urgency and importance around cost of service, make sure you have full transparency, and be able to support audits, et cetera, in demonstrating the costs associated with the services you're providing. So we see these as very strategic goals and objectives, and we feel that we have some great solutions to assist your attainment of these goals and objectives. So first of all, we kind of like to break it down here in terms of patient satisfaction, and I'd just like to also open it up to Jesse and Jeremy. As we'll go through these first couple of slides, if you guys have additional input you'd like to add, feel free to do so. I think that collectively we have a lot of information to share and different perspectives. So first, when we look at patient satisfaction, we see some common initiatives, some programs, sometimes projects that organizations are working on to really help to drive and improve overall patient satisfaction. We see that's a key leverage point for their healthcare organizations, because that will actually help drive revenue per se and profitability, but also it helps with the return of patients to your particular organization. So some of those initiatives that we see is around improving the patient experience. So what's that patient experience when they come to your hospital, as an example, or they come and request a service? So what's that experience? How quick is that experience? Are they able to get access to those services in a timely fashion, or do they get disgruntled and want to leave and go to another organization? So improving that patient experience is really critical, and that really helps drive one of those critical outcomes around satisfaction scores, which then helps drive overall revenue. Next, we see a big focus around patient knowledge. And what we see there is the opportunity to really make sure the patients are educated so that once they leave the facility, they're able to continue with their recovery process. And that way, we can reduce overall healthcare costs for the actual patients, but also guarantee that the patients are establishing that full recovery and not needing that readmission. So by educating them with the proper knowledge, then they understand the importance of following through with the next steps once they are discharged. Next is to reduce those admission and departure times. So as part of patient satisfaction, I know myself in the past hate waiting in big long lines and in big waiting rooms to get admitted, as well as once you feel like you're feeling better, you like to leave and get back to your comfort of your home. So how to reduce those admission and departure times are really critical. So we see here in terms of outcomes, the opportunity to really drive those patient satisfaction scores. How do we look at that full, complete recovery and really avoid readmission? And then how do we look at increasing return visits for other services? We definitely don't want return visits for the same particular case, but we're definitely looking for family members and patients to continue to visit their healthcare provider. So overall, as you can kind of see here, we're really focused on strategies and outcomes and how can we assist organizations in achieving those through technology, which we'll talk about later when we talk about how technology can enable these outcomes. First, before we jump to the next slide, but Jesse or Jeremy, anything you guys would like to add on patient satisfaction?
Hey, John, this is Jeremy, and I'll have Jesse come on top of this. But I think one of the key components we often find with the healthcare organizations that are out there, you know, outside of just the delivery of the patient satisfaction, I think you touched on a couple of really key things. It's the strategic initiatives and the critical outcomes. Oftentimes, those are funded bodies of work, so to say. I think you touched on the project management side. So having an ecosystem outside of just IT, like an IT-centric view, it's more or less that enterprise portfolio management level that allows you to tie some of the goals and some of the activities that you're doing to these initiatives and these outcomes. And then leveraging the ServiceNow platform, I think, as you're very well indoctrinated in as well there at ResultsPositive, is the ability to deliver that across multiple facets of what we call product lines. And product lines are business management, which could be project portfolio or application portfolio, but they're all really driving that body of work. And us working together closely, like with my colleague Jesse Law here, is how those two things, what we call work together, or a better together story, to help deliver that patient satisfaction. And I think those strategies and outcomes should always be something top of mind for organizations looking to drive better goals and outcomes for their consumers and their constituents. Jesse, anything to add, please?
You hit the nail on the head. I think the one thing is the why behind these critical outcomes. And so patient satisfaction is so that you get return business. When you look at no readmission, non-billable readmission, that impacts revenue. And then increased utilization of your resources, because it's a super competitive industry, more than we've seen ever before in healthcare. And so how do you get that individual to want to go to your brand as opposed to just going anywhere to get a specific service? And so that's really the why behind the outcomes. And we're always looking for that and making sure we align that with the strategic initiatives that are set forth by the organization.
Yeah, thanks, Jeremy and Jesse. Very good insights there, and I definitely agree. As was kind of mentioned, what we see that the challenge and the opportunity is determining where should you make those strategic investments, and really what are those outcomes you're going to be looking to achieve. So how do you balance the need for strategic initiatives and investments around patient satisfaction versus quality of care? So that gets into portfolio management capabilities, so you can assess different proposed projects, determine the timeline, the resources and expenses required, so that you can make those right investment decisions so you can achieve those strategic outcomes. So next here, when we look at quality of care, and there's many different dimensions of quality of care. Some of those dimensions you can see here with the different strategic initiatives. So one is the effectiveness of care. So how is the care being provided? Are we following the various best practice guidelines? And are we looking for ways to improve that effectiveness and productivity of caregivers? So that's a key ongoing initiative, so that we can improve that quality of care, and so that we can really reduce issues with patients, and we can really increase the health and wellness of our patients. Next is increasing care access. So not only do we need to provide the quality of care, but part of that factor is do our patients and do our constituents have access to care? Is that access of care provided in a very simple fashion? And so that's and also a common strategic initiative that we see. Also looking at the timeliness of care. So as we all know, based upon when we're able to provide that care, and the timeliness of follow through is really critical for the actual health of the patient. And so it's important to focus on how can we improve the timeliness of care. So some of the critical outcomes we see here is really that compliance with those best practice guidelines. So we know the industry here is heavily regulated, and there's various things that need to be complied with to reduce the overall liability of the organization, but at the same time to make sure that we're not missing something and that we're correctly diagnosing and providing the right remedies for each one of the patients. Then looking at those readmission rates. So if we're more effective in the quality of care and the timeliness of care, we're able to reduce the amount of readmission of patients. As we talked earlier, also looking for ways to further educate and equip the patients with more knowledge so that they can continue with their healing process. And then what we see a lot at times, patients not being seen as they come in because of long lead times, or having to wait for significant periods of time. So that quality of care is a function of that timeliness as well as the effectiveness. So here again are some other opportunities to determine where should we invest, what projects should we focus on to really drive these critical outcomes. So in terms of quality care and the associated strategies here, Jeremy and Jesse, I'll just throw it out to you guys if you have any other perspectives or insights you'd like to provide.
So, I mean, the compliance issue here is huge. When we look at the auditing bodies, and you look at the percentage of funds that come in from Medicare and Medicaid, and so that piece right there, being able to show auditors not only your workflow, but also your remediation should something not go as planned, that's huge. And the ability to capture that in a single location.
What's really key is the governance, risk, and compliance side of things. Is the quality of care is often the domain. I think we're going to touch on this here in a bit, John and Jesse, is that as we move to that more digital age, right? So we've got the advent of technology behind us. It's the release cadence as well. So the quality of care has to be measured by the outcomes, but it's also that so to say release cadence, or now what a lot of people call that the development operations side. You have to have a package of everything that's been touched across the ecosystem of not only alone IT, but also the ability to measure customer satisfaction and how those outcomes that you're trying to tie to are remediating or reducing certain rates. So I think that's really key to some of the goals in healthcare today, which is the reduction of cost of healthcare. And it's just kind of what we see across the ecosystem.
Yeah, thanks, Jeremy and Jesse. Very good insights, and you're exactly correct. It's really important to make sure we have the ability to monitor the delivery of care, its effectiveness, as well as the compliance, so that number one, we're providing that great care, but number two, making sure that we are complying with our obligations. So thanks again for your insights there, and we'll have a chance to talk about quality of care and how technology can help with that digitization and then overall governance. So next we want to talk about cost of service. So it kind of follows from the whole compliance area. One component of cost of service is compliance, actually. So healthcare organizations have to provide that full, complete audit trail of their costs associated with the pricing of their services. And so that really helps with some of their reimbursement rates, whether it be from Medicaid or other programs. So cost of service is really important. It's kind of the lifeblood, if you will, of an organization. And so there are typical strategic initiatives that we see in this space that organizations are looking at investing in and really trying to drive some tangible outcomes. So we see organizations looking to really reduce that service delivery cost. So how can I digitize and automate some of the different processes? How can we digitize some of that compliance? How can we digitize some of our own internal auditing, if you will? So a lot of areas to invest in that particular space. Next, there's productivity improvement. So looking for ways to use technology so that we can use machine learning. Maybe we can use artificial intelligence in conjunction with automation so that we can reduce the amount of labor needed to perform various repeatable functions so that we can spend our time on those high value, high risk functions in providing healthcare service. Next, we need to have that full auditability and tracking, as mentioned earlier. So how do we do that in a streamlined fashion so we're not adding additional overhead and expense to the organization? So as I mentioned before, this is just a critical area for making those type of project investments, and it becomes a balancing act. Which one of these initiatives do you focus on for cost of service versus those for quality of care versus those for patient satisfaction? So that's really that role of the portfolio manager that's really looking at the strategies, mapping those to the overall strategic objectives of the organization, and determining where the investment should be each year, where we should spend more on an annual basis around cost of service versus spending more on quality of service, as an example. So really a lot of opportunities here as you look at strategically managing those project investments, focusing on outcomes. So I'll kind of pause there and see if Jesse or Jeremy would have anything like to add to around cost of service.
We'll touch on this here a little bit when I dive into a few of those components, but I think from a cost of service perspective, what we often see, not only just in the healthcare industry, but across the ecosystem again, is that the delivery of a service can be faceted into customer satisfaction, strategic initiatives, but having this in a single system of engagement or a single system of action to know that, infrastructure costs tied to application or business capability delivery is something that is really prevalent. And we follow that from a common services data model as well that really allows a better conversation inside of organizations to discuss the cost of delivering those services. And oftentimes that data is disparate and comes from multiple areas. So the ability to have one single lens and purview to really what that service delivery component is allows you to actually arrive at what I like to call a directional cost of ownership versus total cost of ownership, because oftentimes that's really the total cost of ownership is the end game for a lot of folks from a cost of service and delivery. But tying with the customer success and customer satisfaction side is, are we actually providing value and delivering on the outcomes we achieve? So cost of service becomes multifaceted again across customer satisfaction, but as well the actual nuts and bolts of how that's delivered.
Thanks, Jeremy. Thanks so much for your insights and the power of a single platform. Jesse, anything you'd like to add?
So I think the biggest thing is getting your arms around resource utilization and understanding the trends so that you staff appropriately and they're data-driven models to understand reasons for why you're using the staff that you're using. Because at the end of the day, in order to impact cost to serve, you have to do the most you can with the least expensive resource. So you need to understand who's getting assigned what tasks and when.
No, that's a very good point, Jesse. What we typically see in helping organizations implement some of these strategic portfolio solutions is a lot of times organizations actually have the funding to work on various initiatives, but they find that they don't have visibility and they don't have the right resources to actually implement the various initiatives and achieve the outcomes. So it is very critical to have that visibility into resource utilization by the different skill sets so we can actually attain the outcomes with your investments. So thank you, Jeremy and Jesse, for your insights. So I'm going to turn it over to Jesse here. He's going to talk a little about patient satisfaction, and then he's going to highlight some different solution options, and then we'll continue on with the flow here. So Jesse, I'll turn it over to you.
Yeah, I appreciate it. So when we look at patient satisfaction, patient is basically being driven by what they're seeing in their consumer world. And they step into our world of healthcare and they feel like they've gone back a few steps. So there are really 5 things that we look at as foundational. It's that make it easy for the customer with the engagement layer. And then you go from there to basically tracking the interaction with that individual and reducing the one-off challenges by allowing self-serve. And then that pushes the ability for the patient to only interact with your resources for things that need to be addressed. So where do I send my bill? What have we done to this point in healthcare? If I call into an organization, I will have maybe the phone system tell me, push one for billing, but we haven't gone and taken that to a digital platform and made it mobile. And so having that ability is huge on a single platform. Once the individual or patient shows up to the facility for the service that they're looking to receive, assigning tasks to the correct individuals in a timely manner and orchestrating the work is a huge need in order to not only reduce the cost of service, but also to reduce the time that the patient has to spend with the organization. And what I mean by that is when a patient shows up, there are certain steps, whether it's getting your blood pressure, doing the scale, what have you. Rethinking the way that that is done could actually increase efficiency to where the doctor is seeing the patient only after all the steps have been done, and the tasks are actually showing up to the physician or the physician's assistant only when the patient is ready to be seen. The other thing as well is monitoring anything. For instance, if you're going to your OBGYN and that individual gets called in to deliver, and the patients that are scheduled to go see that individual for an office visit are then proactively notified that there will be a longer wait or they need to reschedule, and you're valuing your patient's time. We do this and we see this in our consumer lives, but we don't see this in healthcare. And then the last thing is really fixing issues. For instance, if you know that there was a bill sent to a patient and it was in error, instead of blasting everyone in your database or not acknowledging it and just waiting for certain individuals to call in, proactively notifying the individuals that were impacted and doing it and meeting them on the platform that they want to be interacted with. So it's knowing that patient as well. That's huge. Some of the things that we see are the easy on-site check-in and check-out. This really is pre-op, post-op, coordinating the work that needs to be done. Some of the innovative things is that we're seeing in our consumer lives. You'll go to a hospitality location, a casino or what have you, and they will have the ability for voice activation interaction in the rooms. We're seeing that now bleed into healthcare. And then, as we look at the external and internal customers, really it's easy access to the best care at the right time. And so if we want to move forward to the next slide, we've got really 3 pillars that we focus on. And it's really, which phase do you find yourself as an institution in? Most people are in more than one of these buckets. Most people are in a modernize and transform phase of their business. When I go out and sit with our clients, they are making their systems to the latest version. They're going to mobile, and they're also transforming the way that they do work. And only after they get those foundational pieces in place do I see people moving to an innovation phase where they're going to provide their patients with something that is different or differentiated from the rest of the healthcare system. For instance, we see this in banking. Innovation has a very short shelf life. In banking, the ability to take a picture of a check and have it deposited was an innovation by one brand. 9 months later, all the major banks are offering that service. So this is where innovation, we're seeing it in all facets of our lives, but in healthcare, the innovation piece really is that Alexa voice-activated request as opposed to a call button in a room, and being able to understand through natural language, understanding what is being asked and the resource that needs to be assigned. So if you've fallen, I need a nurse, and it needs to be a priority 1, the patient's fallen. If it's, I want to have this for dinner, assign it to catering, and let them understand what they need to prepare for this individual, but also have a workflow that checks if they are allowed to have that type of request based on the dietary restrictions that are put on them. So knowing that individual, and this is coordination of work, not of all your platforms, because you have electronic medical record systems today. And so we're not pulling that data in, we're just referencing that data to see and be able to make decisions through machine learning. That's when you get to the innovation phase. You know, as we look at transform, some of the things that we're seeing individuals do from a flu shot perspective, you're seeing more and more people that you've never seen before from a competitive standpoint get into that marketplace. First, it was the CVS's of the world and the drugstore being able to offer it. Now you're seeing it at a grander scale of Walmart bringing this. It's basically a very fast transaction that you can capture, and it's good reimbursement because most insurance will pay for that. And so how do you capture that type of business? Maybe you do it through coordination of work with having a mobile clinic go to a large employer and set up there and have that already coordinated with your facility and that employer so that you're capturing that revenue and it's not going down the street to Walmart, and then your facilities are only being used for the high dollar, high cost treatment with low reimbursement rates. So with that, I think Jeremy, I don't know if you have anything on the patient experience, or John, if you want to talk about anything, but
thanks so much, Jesse. That's very useful. I'm just looking at the time. I probably need to move forward to the next phase, but just everybody kind of recognize here how you can apply technology to modernize, transform, and innovate. And some of these items we're kind of mentioning here is kind of wanting to challenge everyone's thinking a little bit and kind of let you know the art of the possibility. So and some of these things are real. Some of these things we see coming very shortly, but it's all about determining where you want to invest and you know, which technology solutions you want to tap into. So I'm going to talk just briefly here about quality of service, and then I'll be handing over to Jeremy to talk about cost of service. So when it comes to quality of service, as I mentioned before, in terms of various initiatives and the associated outcomes, we're really looking for ways to enhance that quality of service and the effectiveness of that. So typically what we see from an internal staff perspective, because this is really where a majority of the work is being done so that we can improve that quality of service. One is there a way that you can digitally get access to all your best practices in one central place? Have ability to easily manage and maintain that knowledge base for those guidelines, be able to publish those, be able to edit those, but also be able to provide those easily available to any one of your staff members on any device, anywhere, anytime. And so that's one of the solutions that we help implement using the ServiceNow technology. How do you digitize and automate different processes so that you can increase the effectiveness, so you can remove all those mundane processes so that you can get to that face-to-face interaction with the physician, but yet completing all of the compliance requirements? How do you really focus on continuous improvement and using really machine learning or artificial intelligence to identify where are some of the current roadblocks in your process, where are the automation and simplification opportunities? And so by focusing on those areas, we see that it's able to drive benefits to the patients. So it helps to streamline that admission process or the checkout process. It really supports the end-to-end interaction of processes as those requests are coming in from the patient. So these are some of the areas that we see of using solutions to really drive quality of service. So when we look at quality of service in terms of the modernize, transform, and innovate, I kind of mentioned the whole idea around the guidelines, having that knowledge base available anytime, anywhere. So that's a core capability, but it's also more impactful when it's on one single system of record that's tied into your actual business processes. So you can actually utilize the knowledge base as you're going through a business process, thereby actually creating more opportunities for automation. From a transformation perspective, we're seeing organizations where they want to apply technologies and business models outside of healthcare to really drive that patient experience and quality of care through providing on-demand access to housekeeping to come in and clean a room. Say someone spills something, wouldn't it be nice if I could have on-demand, they could quickly identify who's available and get that person there immediately. Also on-demand ordering and pickup of the food or pickup of trays to make sure that we improve that quality of care and reduce opportunities for accidents. How about using it on-demand to really solicit and identify who's available right now to do that patient transport to get that patient safely to their vehicle as they're leaving the organization. So there's some innovative ways to apply technology through web and mobile applications to provide that on-demand view of available staff internal to the organization, thereby to provide those services in a more efficient manner. Next, we see ways to innovate, to really provide that innovation type portal across the organizations. Those are looking for ways to enhance care. They can have a way that all those ideas can be collected. They can go through a social vetting process as well as then a formal vetting process to determine which one of those, combined with the analysis from analytics and machine learning, to identify what are those high value, low risk areas that we can improve quality of care. And so by having that ability to have a centralized portal to be able to manage that ideation process at the same time to have that access to your knowledge base all in the same single system of record. Jeremy, we'll turn it over to you here quickly to talk about risk and compliance as well as cost of service.
Hey, not a problem. Hey, thanks, John, and thanks everybody again for joining the call here. One of the things that I'm going to go over here for the afternoon is, outside of the initiatives and the outcomes that we've talked about, is really, if we look at some of the approaches from the core of an ecosystem across not only the ServiceNow platform, but what partners like ResultsPositive have helped us and our other customers endeavor against, is understanding what the body of work is. So when we talk about reducing compliance risk and defining a cost of service, there's often a couple of different sides of that story. There's the business or the organizational side, and then there's the technology. Like, what are we doing to deliver that service? So I'm going to go back to my earlier statement, which talks about so to say, it might be allocation of funds or allocation of an infrastructure or an asset that is mapped, that has controls that are governance assigned to them. So those controls to those services, what they deliver, also have to identify top risks. So you have to be able to have an auditable trail, not only because of the regulation categories that are placed out there today, but you also have to remediate any issues that happen quickly. That occurs obviously by nature on the ServiceNow platform through your ITIL-based processes. But there's also the visibility on top of all of the work you're doing to deliver the outcomes and the initiatives. And in automating some of that reporting, you need to have, again, that single system of engagement, which we often find from that auditable cost of service component. There's two facets. That's the compliance side, then there's also the cost of what happens if I'm not compliant and I cannot address and track and manage those service delivery costs. So it's tracking the end-to-end IT delivery of costs to that service, so that modernization. To be able to modernize, you kind of have to know, it's almost, where have I been, or where am I going? And to transform, which I'm going to touch on here quickly, oftentimes the Gartner-centric terms, run, grow, transform. I think most organizations out there follow that in multiple areas. So being able to track cost of service for mobile vaccination units or Community Connect. Community Connect to vernacular align with a lot of individuals. We find extending out Epic as an example, as an organization, to the community as well. So how do we actually reduce the cost of service to control and own and have Epic in-house, but also how do we bring on board other institutions, other organizations that can leverage the ecosystem of Epic or Furner in that example, which then allows you to innovate and identify, are we working on the right things? That strategic or enterprise level portfolio management. Now, keep in mind, we've talked a lot about IT and IT service delivery of cost, but this is much larger than just the IT delivery. IT is the real arm of delivering a positive service and a patient outcome. I know myself, as an individual, I have certain expectations. I want to be able to log in, schedule, know if I need to go to a vaccination unit. All of the components in our digital world we live in today, all are manifested out of a body of work. And no pun intended, using the phrasing body here. A body of work is oftentimes described around a couple of different facets. At a business or an organizational executive level, there's a strategy. Let's go all the way back to our beginning of this webinar conversation. It's the initiatives and the outcomes. How are we aligning what we're working on to deliver better patient outcomes? But then there's also the facet of the delivery. It's not meant to say that there's the tactical and the strategic side in separate silos. It's breaking down those silos so that we see organizations that are moving in that body of work from a portfolio management centered view. Don't just view this as Microsoft project or choose your own adventure tool that's out there. It's the orchestration of what you're working on, what you're delivering, and how fast you're delivering with quality, auditability, governance, risk, and compliance to execute on that. One of the things that I think is also important, and is we look at strategic, oftentimes I would ask, and I do see this with a lot of our customers, and Jesse and I have been on the phone with a number of them that say, replace kind of some of these strategic initiatives at the top. I want to deliver new products. I need to be competitive. I need to be bleeding edge so that I'm also delivering better services. But there's also that digital transformation, the customer, the employee experience, the analytical data that you have to actually make proper decisions. That's what the strategy needs to be. But there's also that idea, the demand, the intake. I think, John, you mentioned this earlier around like idea portals. Hey, I've got a great idea. If we actually put Alexa into these certain rooms and we had a workflow for a request of a certain dietary restriction type because I want something for dinner that evening, those are all new ideas. That I actually have to be able to deliver and execute upon those. It's really, there's a lot of different ways that folks will build and work on those methods and deliverables today, and they all have a varying degree of focus. And what we often look at today as well, across healthcare, across multiple facets, is the way that individuals are working is in silos, but also the silos are PowerPoint, Excel. I'm pretty sure someone out there is hearing this that has dealt with this, or you deal with this today. And it's not necessarily saying that all of those processes are going to go by the wayside. But if we look at what we typically see in healthcare and also in the industry, is that from a transformation perspective, if anybody on the line is using transformation as an initiative, there's also the keep the lights on. I have to continue doing things to provide the quality of service that I am delivering today. So if you could shift some of the idea, the demand, the intake, the actual body of work you're doing to more resource allocated, transformation-based initiative approaches, then you can look at that 73 to 27% typically shifting. And by doing so, it allows you to actually deliver those better patient outcomes and initiatives. And some of the ways that we help leverage and build that into the ServiceNow platform is through managing the bodies of work, streamlined workflows, project management, the core of that, agile delivery, as well as application, business capability, and portfolio management. And so as I start to look at that again, we can build this out from a high-level piece of maintaining technology, incidents, changes, problems. That's that IT-centric stack of the world, and then also the strategic vision as to what we're delivering. So if you think about the bodies of work, and I think, John, you touched on this, it was interesting. You talked about continuous improvement. I have processes. We just talked about keep the lights on, kind of the run the business is what typically the Gartner-centric terms would be. The top level, we have strategic investments to deliver on those outcomes. The bottom is scaling and being able to work in multiple facets. We call it sometimes in my world, the scrum fall, the agile, or you might call it hybrid. It's that you now have individuals who are delivering those services, and those individuals are your largest component of cost. A Dell GL385 is going to be an infrastructure asset at the very bottom of a model that says, yeah, I've got to break, I've got to fix that, it's got to be in compliance, it might have HIPAA rules. Those should be standard IT workflow processes that are leveraged. But the continuous portfolio planning and improvement of that is the core grassroots of understanding the body of work to actually deliver a cost of service out to not only your customers, but your internal customers as well. So tying these three things together becomes really important from what we like to call, or what the industry is now calling, continuous planning. How am I being able to react to incidences, but also understand the cost of that reaction and future-proof our solutions to enable better patient outcomes, to enable better quality of care. So that manifests itself in a couple of different facets. And one more slide here, Sean, and then I'll hand back over to you, John, is that something I would really encourage a lot of you who are on the line or listening to this post-webinar is following what we call the CSDM. I know we all deal with acronyms out there in the world, but it's the Common Service Data Model. A couple of things that are really important is that infrastructure CIs, think about the IT operational management side of the equation, classifying what an application does, or the service offering. We just discussed incidents, change, problems. This is the way we thread and tie all of those ecosystems together across the entirety of a common data model, which is an industry best practice and standard. A business capability, by all measure, could be better patient outcomes. To have an understanding across the platform as to where each component of cost, service, of labor, delivery, what you're actually calling an application, what you're calling that Alexa who's ordering food via request. If you think about a top-down or a bottom-up approach, either way is totally okay in this equation, is going to help you deliver a better service, but also help you arrive at the cost of delivering that service. So as well, I think we've mentioned that these slides will be available afterwards. And again, if you guys have questions moving forward on the Common Service Data Model as well after this, that would be more than happy to help address that.
Yeah, thanks so much, Jeremy. That was very insightful and really valuable discussion there. So really appreciate that, kind of tying everything back to the strategies and outcomes and then having that single platform. One thing I'd add here kind of to the data model and having that single platform, you look at a cost of service, you know, in one aspect, it's kind of easy to do that top-down cost of service. But if you don't have all the data elements and components on the single platform, and in addition to that, if you don't have access to all those work requests coming in from patients or the internal work requests, and those actual requests themselves take time and money, which translate into overall cost. So having all of that on the same platform, you can get a true cost of service, and that cost of service would include all those transactions that are occurring for all those work orders and those end-to-end processes, as well as just the different data models and the different components all on the same platform. So thank you. So last thing here, and I'll just do this really quick. As you can see here, when you look at modernizing and transforming the organization, typically in today's world requires some form of a digital transformation, some type of digitization of current business processes, work management, work functions, as well as just engagement with patients, as we've been mentioning today. So within the ServiceNow platform, you can have all the tools to build your own custom application. So you can digitize those workflows. You can connect those workflow actions across obviously everything on the platform, which makes it a lot easier. But then when you have the external systems, so you can do the end-to-end process, you can connect and have those tools to do those integrations. So it's a great way to have a platform by which you can build your own custom applications. You can also do that very easily, so it doesn't require the in-depth, building things from scratch, if you will. You've got a platform to really accelerate that timeline. So we've talked a lot today about overall strategies and outcomes, and really kind of wanted to lead with that. We've kind of webbed in some discussion around solution examples with customers, how you can apply ServiceNow. One thing we just wanted to highlight with ResultsPositive as a partner, we really help organizations create those business solutions so you can achieve those outcomes. And we've been doing that with our consulting services, whether it be from advisory and roadmap to actual application development and analytics. So we've been doing that with over 300 customers over the last 14 years, and ServiceNow being our strategic partner with their platform for digital change and digital transformation. So just wanted to highlight here some examples as part of us being able to build custom solutions. We do build those on the ServiceNow platform, as well as we build those custom based upon customer requirements. Our core focus is really around creating those impactful end user experiences and being able to digitize and streamline business processes, and also look for ways to innovate. Is there a different way of accomplishing the same goal in a more streamlined fashion? Thereby we can improve the productivity, the effectiveness, and say quality of care. So a couple examples here, looking for ways to tie this to healthcare, look at opportunities to really improve patient satisfaction by helping patients as well as visitors navigate across the hospital. So that's an example of creating custom apps that we do. Another example is being able to really help automate that request process. So this is something that we do on the ServiceNow platform as well as with custom apps. So internally, organizations, when they get that voice-activated request or they get that face-to-face request, they can quickly check who's available and provide that on-demand function, getting someone very quickly to come in, perform housekeeping or that particular move or transport service. And then just the ability to do the digitization, because we've been talking here on the ServiceNow platform, using their own mobile apps, which can also be tailored to your organization's needs. So in terms of ServiceNow, and just to kind of provide you with a brief overview, it is a single platform that really helps organizations simplify and enhance the way they do work and then drive additional outcomes. As you can see here, there's different, I would say, modules on the platform. And so you're looking at business and IT solutions. We've been talking about project portfolio management, how to make the strategic investments. So that's both the business and IT function. Jesse's been talking a little bit about customer service, how that can be applied to really help patients, but also can be applied to help external and internal customers. We see HR departments as a way to really manage that work, manage those requests, provide that access to policies, but really helping to streamline the delivery of service to all of the employee base so they can be more productive. There's security and the ability to really build those intelligent business applications. So on the platform here, that's really where the value comes into play. So we've been talking a lot about how do we look at digitizing workflow, how do we look at providing analytics, how do we look at providing different user experiences, whether it be that self-service or whether it be, say, even from a virtual agent perspective. So all of those items around user experience, the service intelligence, as well as just the end-to-end workflow is all based on the core platform. That platform is then used to establish these different other solutions, as you can see on top. But also we see many organizations then creating their own solutions with the app development capabilities on the platform. So the next slide kind of gives you a deep dive into all the different capabilities in each one of the modules here with ServiceNow. So I'm just going to pull Jeremy and Jesse if they wanted to have their 2 or 3 sentences here on an overview of ServiceNow, and then we'll move on and wrap up the webinar today. So why don't we start with you, Jesse?
Sure. So I think if you had one takeaway, ServiceNow really focuses on coordinating work and resources in order to solve customer challenges and provide a wonderful experience. So we focus on end-to-end issue remediation, and then we focus on customer retention. So with that, I'll turn it over to Jeremy.
Thanks, Jesse.
Not sure I could follow up better than that, Jesse, but I think you nailed it right on the head. I like to call from the business management perspective, you look here at the bottom of the slide, the ecosystem of everything that occurs, success, delivery, customer engagement, customer satisfaction, all the way down to the incident change and initial request perspective. All of that from a running IT or just a business management from a portfolio perspective is spanned across the beauty of the ServiceNow platform and the visibility and transparency that you have across the service delivery aspects to help deliver better patient outcomes and better patient care. I think those are things that we all really care about because at the end of the day, we're all patients. So thank you, John, for hosting this afternoon, and looking forward to any questions or comments that have come in through the webinar here.
Yeah, thanks, Jeremy and Jesse. And that's definitely why we love working with ServiceNow, because you can really focus on driving tangible outcomes and positive results, which we're all about with our customers. But also what we're also excited about is customers get value out of each one of these solutions, and they're always asking for what's the next area that we can innovate in our organization, what's the next area that we can digitize so we can more effectively manage our work. So we've enjoyed the partnership, and as well as with our customers, helping them achieve those outcomes. So if you're looking at where do I go next, how do we identify where we should focus first, how do we leverage the ServiceNow and ResultsPositive? We have multiple starting points. Typically, organizations will schedule their discovery session. We get to kind of review where you are today, what you're looking to achieve, understanding your environment, and then we can identify how we can apply business process and technology to achieve those specific outcomes. Now the starting point is coming in, assessing where you're at, identifying those opportunities, or coming in and actually creating a roadmap and really focusing on scoping and estimating that first project to drive success for that initiative and that outcome. So multiple starting points that we can assist customers with. So thanks again, everyone, for attending today. Jeremy and Jesse, it was an honor to have you join us today. We really appreciate your insights and your leadership. So thanks again for joining. And those of you that have logged in today, will definitely be following up with you as an opportunity to schedule and participate in your discovery workshop. Scheduling a session, maybe you have a current initiative and we just need to get that scoped so that you can make that a reality. Or we can follow up and provide you with an overview of specific components of the ServiceNow solution. So I want to thank everyone for attending today. So I want to provide contact information here with Jesse and Jeremy, and I want to thank everyone for participating in our webinar today.